Greetings to our listeners. Today we will talk about English serial killer Beverley Allitt, known as Angel of Death, who was convicted of killing 4 infants. Don't forget to click the subscribe button. Beverley Allitt was born on October 4, 1968, in Corby, England. Allitt often struggled with health issues during her childhood, which shaped her interest in the healthcare industry later in life. While growing up as one of 4 children, Beverley displayed some worrying tendencies early on. She was wearing bandages and plasters on her wounds to attract attention without allowing anyone to look at those wounds. She became overweight in adolescence and began to attract more attention, and often showed aggression towards others. She was constantly seeking medical attention in hospitals for a number of physical ailments. Her recovery was slow because she insisted on intervention rather than surgery. She was also known to engage in self-harm. Doctors said that she did these things on purpose in order to attract attention. Health problems can often increase a person's desire for empathy and care, but Allitt's case may mark the beginning of factors that led her to harm pediatric patients. Although it is not known for certain whether the health problems she experienced in her childhood affected her interest in the healthcare sector and her desire to work in this field, experiences may have affected Allitt's tendencies in the later periods of her life. Allitt's behavior during adolescence appeared to be a Munchausen syndrome, a psychological condition where someone pretends to be ill or deliberately produces symptoms of illness in themselves. She also began to harm others to satisfy her desire to be noticed. She was training as a nurse and exhibited strange behavior. She was absent most of the time as a result of various illnesses. Her boyfriend at the time claimed she was aggressive, manipulative, and deceptive. She faked a pregnancy before the relationship ended. Despite her past absences and repeated failures in the nursing exams, she was hired on a 6-month temporary contract at the understaffed hospital in Lincolnshire in 1991. She started working in the children's ward. When she was hired, she worked only 2 day shifts and 2 night shifts. On February 21, 1991, her first victim, 7-month-old Liam Taylor, was admitted to the pediatric ward with a chest infection. Allitt did her best to reassure his family that Liam was in safe hands and suggested that they went home to get some rest. When they returned, Allitt told them that Liam had had a respiratory emergency but was recovering. She volunteered for an extra night shift to keep an eye on the boy, and his family chose to spend the night in the hospital. Liam had another respiratory attack just before the night break. Allitt was once again left alone with the child, and the child's condition deteriorated dramatically before he became pale and red spots appeared on his face, at which point Allitt called an emergency support team. They were confused because the alarm did not sound when they left. Liam's heart stopped, and despite all the efforts of the team, his brain was seriously damaged, but he survived with the help of life support machines. Following medical advice, his parents made the fateful decision to remove their baby from life support, and a cause of death was recorded as heart failure. Allitt was never questioned about his role in Liam's death. Just 2 weeks after Liam's death, Allitt's next victim was Timothy Hardwick, an 11-year-old cerebral palsy patient who was hospitalized following an epileptic seizure on March 5, 1991. Allitt took over the care of the child and again met him after a period of time alone with. He called the emergency resuscitation team, who found Timothy pulseless and bruised. Despite all the efforts of the team, including a pediatrician, they could not bring the child back to life. Although epilepsy was officially emphasized in the autopsy performed later, no obvious cause of death was found. The third victim, 1-year-old Kaylee Desmond, was hospitalized for a chest infection on March 3, 1991, and her condition seemed to improve. 5 days later, Kaylee had a heart attack in the same bed where Liam Taylor died 2 weeks earlier, and the resuscitation team managed to revive her. She was transferred to another hospital in Nottingham where, during a thorough examination, doctors discovered a strange puncture wound in her armpit. They also discovered an air bubble near the puncture mark, which they attributed to an accidental injection. But no investigation was launched. 5-month-old Paul Crampton was Allitt's next victim. On March 20, 1991, he was admitted to the ward due to a bronchial infection. Just before he was discharged, Allitt, who was again taking care of a patient alone, saw that the child had fallen into a coma and called the help team. The doctors did not revive him every time. They could not explain the fluctuation. Allitt went with him. Again, it was determined that he had too much insulin. Paul was extremely lucky to survive what the angel of death did. The following day, 5-year-old Bradley Gibson, who was suffering from pneumonia, unexpectedly went into cardiac arrest, but was saved by the resuscitation team. Blood tests revealed that his insulin levels were high, which did not mean anything to the doctors. Allitt's intervention resulted in another heart attack later that night. The child was transferred to Nottingham, where he recovered. Despite this alarming increase in the frequency of unexplained deaths, no suspicions were raised, and Allitt continued her violent actions. On March 22, 1991, her 2-year-old victim Han Chen appeared bruised and in serious distress after Allitt raised the alarm. However, Chen responded well to oxygen. After another attack, he was transferred to another large hospital, where he recovered. His symptoms were attributed to a fracture in his head resulting from a fall. Allitt then focused her attention on 2-month-old prematurely born twins Kate and Becky, who had just been kept under observation for premature birth. Becky, who was under the care of Allitt, was brought to the ward due to gastroenteritis on April 1, 1991. 2 days later, Allitt raised the alarm, claiming that Becky appeared hypoglycemic and cold. No discomfort was observed in the baby. Becky was sent home with her mother. She had convulsions throughout the night and cried in obvious pain, but when called, a doctor said she had colic. Her parents kept her in bed to monitor her. By the end of that night, the baby died. Despite an autopsy, pathologists could not find a clear cause of death. Another twin, Kate, was still alive. Allitt was there again. It didn't take long for Allitt to call the team again to resuscitate the baby, who had stopped breathing. Efforts to resuscitate Kate were successful. However, 2 days later, she suffered a similar attack that resulted in her lungs collapsing. After another resuscitation attempt, it was determined that Kate had 5 broken ribs and serious brain damage due to lack of oxygen. Ironically, Kate's mother was so grateful to Allitt for allegedly saving her baby's life that she asked her to be Kate's godparent. Allitt agreed willingly, even though she had given the baby partial paralysis, cerebral palsy, and damage to vision and hearing. 4 more victims followed. However, the high rate of unexplained attacks in healthy patients and Allitt's involvement in all these cases generated suspicions. Her tantrum on April 22, 1991 resulted in the death of 15-month-old Claire Pack. The baby, who was only a few minutes under Allitt's care, had a heart attack. The resuscitation team successfully brought Claire back to life, but when she was left alone again with Allitt, the baby had a second crisis and could not survive this crisis. The autopsy showed that it was due to natural causes. Despite the autopsy result, Dr. Porter, one of the hospital's consultants, was alarmed by the numerous heart attacks in the juvenile detention center in the last 2 months and launched an investigation. Initially, an airborne virus was suspected. A test revealed that there was potassium in Claire's body when she was exhumed. Traces of a drug used during cardiac arrest, but not meant for infants, were found. Police Inspector Stuart Clifton, who was assigned to the investigation, suspected murder and examined other suspicious cases that had occurred in the previous 2 months, and found excessive doses of insulin in most of them. Suspicions were further raised when further evidence revealed that daily nursing records were incomplete. 25 separate suspicious incidents, including 4 deaths, were identified. The only common factor was Beverley Allitt's presence in each incident. By July 26, 1991, police had sufficient evidence to charge Allitt with murder. Allitt remained calm during interrogation, denying any role in the attacks and insisting she was merely caring for the victims. A search of her home found parts of missing nursing records. Further police investigations revealed that Allitt had a very serious personality disorder. She had Munchausen syndrome. She was also prone to harm others to attract attention. It is highly unusual for both conditions to occur in an individual. Allitt's behavior during adolescence was seen as typical of Munchausen syndrome, and when pretending to be sick failed to elicit the desired reactions in others, she began to harm patients to satisfy her desire to be noticed. While in prison, despite visits and evaluations by a number of health professionals, Allitt refused to confess to her actions. After a series of hearings, she was charged with 11 counts of murder, 11 counts of attempted murder, and 11 counts of inflicting grievous bodily harm. While awaiting her trial, she rapidly lost weight and developed anorexia nervosa, another indicator of her psychological problems. After numerous delays due to her illnesses, she stood trial at Nottingham Crown Court on February 15, 1993. Prosecutors showed the jury how she was present at every suspicious incident, and that the incidents stopped occurring when she was released from hospital. High insulin and potassium levels in each of the victims, as well as evidence of drug injection and puncture marks, were also linked to Allitt. Her unusual behavior was brought to light. Professor Maddow presented evidence that, in his opinion, Beverley Allitt could never be cured, making her a clear danger to anyone she might come into contact with. After a trial lasting nearly 2 months, Allitt was found guilty on May 23, 1993, and sentenced to 13 life imprisonment for murder and attempted murder. She was sentenced to the harshest sentence ever handed down to a woman in England. The impact of Allitt's case on the hospital where she worked was so severe that the hospital's maternity unit was closed. Instead of going to prison, Beverley Allitt was imprisoned at Rampton Secure Hospital in Nottinghamshire. This is mostly a prison for people detained under the mental health law. During her detention, Allitt resumed her attention-seeking behavior. She swallowed crushed glass and poured boiling water on her hands. She later admitted 3 of the murders and 6 of the assaults for which she stood accused. The appalling nature of her crimes placed her on the Home Office list of offenders who could never be paroled. Rampton Secure Hospital was more like a holiday camp than a prison, a facility which has 1,400 staff looking after approximately 400 inmates. Costs taxpayers around $3,000 per inmate per week. In 2001, there were reports that Allitt was going to marry fellow inmate Mark Hagee, but today she is single. She was last the subject of a Mirror investigation in May 2005, which revealed that he had received more than $4,000 in state aid since she was imprisoned in 1993. In August 2006, Allitt applied for a review of her sentence, whereupon the probation service asked the victims about the process. Beverley Allitt remains in Rampton Hospital.